It also allows in post-processing images. Computated tomography, also known as CT scan. The CT scan are mainly complex imaging systems which use thin beam of X-ray that move in synchronous manner with an array of dictators. This data is fed into computer, which performs numerous calculations as per the program and construct the accurate images in the coronal and axial planes. Cone beam computed tomography, also known as CBCT. CBCT technology uses cone-shaped source for ionizing the radiation and two-dimensional dictator. It provides multidimensional and dimensionally accurate image for diagnosis and treatment planning. The main advantage is the low radiation resulting from the shorter exposure time. It provides the images of various dental, oral, and maxillofacial structures in multiple orthogonal images, that is in coronal, sagittal, and axial. Indication of CBCT in orthodontics. 3D assessment of the anomaly in dental position, such impaction and ectopic teeth, for example, impacted maxillary canines. It also helps in assessment of the dentofacial abnormalities and deformities like cleft lip and palate, and also it helps in orthodontic surgery. This is the intraoral photograph of a case with impacted maxillary canine, and when a CBCT was taken, this is how the CBCT looks like in volume rendering. And this is the CBCT of coronal view, sagittal view, and axial view, where the impacted canine teeth can be properly visualized. Now 3D cephalometry. Cephalometric measurement on the 2D images suffer from several limitations, and most important drawback is that lateral and frontal cephalograms lack the information about cross-sectional area and volume. But CBCT provides a 3D method of cephalometric analysis. It produces the images that are anatomically true, that's real size 1:1 scale. And with accurate volumetric 3D depiction of hard and soft tissue of the skull, and it also lacks superimposition of the anatomical structures. The 2D cephalograms uses stable reference structures or anatomical landmark, for example, sala turcica for cranial base registration. However, the 2D representation of the 3D structures with a difficulty in identification of the landmark is due to superimposition of the multiple structures, which does not occur in the CBCT images. In contrast, 3D images provide easier and more accurate anatomic landmark registration. This is the 3D cephalometric analysis done with the help of CBCT images. Magnetic resonance imaging, also known as MRI. MRI makes the use of two fundamental properties of photons. It does not have hazard as it uses non-ionizing electromagnetic radiation. MRI allows for repetitive 3D images of dental structures without potential harmful radiation exposure. The advantages of MRI is anatomical details are good as in CT scan, and there's a greater tissue characterization and imaging of the blood vessels, blood flow, visualization of the thrombus is possible. And few disadvantages are time is taken more than CBCT, not using patient with cardiac pacemaker, and non-visualization of the bone makes it useless in bone lesions. Next is DisiGraph. DisiGraph is a synthesis of video imaging computer technology and sonic digitizing. It is a unique device that allows the clinician to perform non-radiographic cephalometric tracing and analysis, video imaging, and treatment planning, including the manipulation of patient's tracing overlaid on the video image. It also takes facial, intraoral, and modal photographs. Cephalometric landmarks are digitized by lightly touching the sonic digitizing probe to a point on the patient's skin corresponding to it. Here is an image where a patient is seated in a DisiGraph workstation, and it is prepared for the sonic digitization. And after the image is taken, a superimposition of the tracing over the patient image is done in DisiGraph. Occlusogram. An occlusogram is 1:1 reproduction of the occlusal surface of plaster powder on a sheet of acetic tracing paper. It is used for estimating occlusal relationship, to estimate the arch length and width, to estimate the tooth movement required in all the 3 planes of space, to estimate the spacing and crowding. It also estimates anchorage requirements. In this picture, at first, the posterior border of the dental cast are perpends, and then the registration groups are placed in the posterior surface of the dental cast. Then the occlusogram camera produces 1:1 positive film frames, and then 1:1 positive film of the occlusal aspect of the dental cast is produced. And with the help of this dental cast, occlusal relationship can be estimated. Now, softwares. CAD/CAM system. Computer-aided design is defined as the application of computer and graphic software to aid the product design from conceptualization to documentation. Computer-aided manufacturing is defined as the effective use of computer in manufacturing, the planning and controlling. Designing usually starts with computer-aided design software, where the actual drawing of the part with a drawing of a part to be machined is made, and then it is followed by generating toolpaths on CAM software. It is used by the orthodontics to require 3-dimensional information of the dentition and associated anatomical structures of the patient, and provide a base of information for interactive computer software based on diagnosis, appliance design, and treatment planning of the patient. This is a it is a CAD software where the braces are designed and adjusted on the maxillary arch. After the braces are designed, then the maxillary tray is designed, also known as maxillary transfer tray. Then the maxillary transfer tray is printed by 3D printing, and after the maxillary tray are printed, the actual braces are then kept in the maxillary tray and then inserted into the patient's mouth by indirect bonding. While doing the indirect bonding, firstly the tray is inserted into the patient's mouth, and the flaps are removed around the bracket base with the maxillary tray seated. Later, the light curing is done, and at last, bonding is completed with arch wires. Insignia is another software. It is a fully interactive software designed to incorporate treatment plan into the Virtual 3D model. It gives patients a specific bracket, computer-assisted bracket placement, custom wire, and all phase of treatment adjustment. It permits precision definition of the final 3D tooth position, taking into account both centric occlusal contact and smile aesthetic. It also helps in finding out pre and post treatment development. Digital imaging software. With the development of technology, we can create treatment plan with just a few mouse movement and concentrating on the facial structure and beauty rather than on holding protractors to measure the angles and distances. And the computer itself generates numerous analysis, superimposition, measurement tables, growth and treatment prediction, and much more with a simple touch of button. And all we need to do is print, store, and email out the results. This is a 3D digital imaging software. So our next topic is recent advances in bonding materials. Bonding materials. Bonding is a method of fixing attachment directly over the enamel using adhesive resins. Bone strength should be high enough to resist the accidental debonding during the whole course of treatment, but also low enough, but it has to be low enough so that the excess force needs to be applied during the debonding at the end of the treatment. With the increased demand of adult orthodontics, to overcome this problem, 6th and 7th generation cement have been introduced, by which it is possible to bond orthodontic materials to gold enamel, gold amalgam, and porcelain. So self-etchant adhesive. Self-etchant adhesive involve a mechanism in which, as soon as the decalcification process is initiated, the infusion of the evacuated spaces by the dentine bonding agent is begun. As a result, the potential or residual vacancies amongst three collagenous fiber is dramatically reduced or eliminated together. Self-agent adhesive are of two types, that is 6th generation bonding agent and the 7th generation bonding agent. Further, the 6th generation bonding agent is divided into type 1 and type 2. Type 1 has two-step, two components, and type 2 has one step and two components. 6th generation bonding material. Primer and the agent are combined in one step. Three examples of 6th generation bonding materials are light care bonding cement capsules, new light care glass ionomer cement, and alpha bonding agents. Starting with light care bonding cement capsules. The band cement is disposable capsule, is no mix light activated glass ionomer cement that contains fluoride to control decalcification under the bands during the extensive treatment. It eliminates excessive waste and cross contamination between patients, and the narrow tube design helps accurately dispense adhesive directly into the molar bands. Next one is light care glass ionomer cement. A light care glass ionomer cement exhibits all the necessary qualities needed to bond the bracket without any itching and in presence of saliva. The debonding procedure were also completely undamaging to the underlying enamel and surfaces. It releases fluoride, so there is no decalcification observed on any teeth on removal of the appliances. Alpop bonding agent. Prompt Alpop is a water-based two-liquid light-activated dentin bonding agent. It is recommended for bonding directly placed light-activated resin composites and copomers to enamel and dentin. Prompt Alpop is the only product that contains all three traditional bonding agent components, that is agent, primer, and adhesive, in one solution that is applied to tooth structures. It is applied to enamel and dentin for 15 seconds. Prompt Alpop has a chief disadvantage, that is low bone strength. This is the image of the Alpop self-etching adhesive. 7th generation bonding material. The agent, primer, and the adhesive resins are combined into one bottle, so there is no mixing required. It is a fluoride releasing which was formed to overcome the problems which was faced in 6th generation, like agent bonding agent and low bone strength. It provides superior bone strength and drift-proof bracket placement as well. So few examples are iBond, G-Bond, Geno 4, Clearfield 5 Plus. This is the image of the G-Bond 7th generation bonding material. Now recent advances in brackets. Handling problem with each individual bracket, and it is clearly identified and pre-oriented on the spatial form liner that virtually eliminates the bracket rotation in transmit. It is fewer step and less time consuming. Indirect bonding. Flowable composites are used, which is applied to the bracket, in the tray. Then the tray is placed to the patient's mouth, and light care is done. This technique allows precise placement and less time consuming. Next one is Invisalign. Invisalign is a technique that enables aligning teeth without the use of braces. It is achieved with aligners made up of transparent membrane that can be taken out anytime if necessary. The Invisalign system offers the first true alternative by utilizing the advances in 3D imaging technology to create a series of customized plastic aligners. Each aligner is planned to move the teeth a maximum of about 0.25 to 0.3 mm over a 2-week period, and the appliance has to be worn minimum of 20 to 22 hours per day, and each aligner should be worn 400 hours to be effective. So how does Invisalign system works? At first, patient record diagnosis and treatment plan is taken. A proper case history, clinical examination, and treatment plan is formulated. Then record submission. In record submission, polymer silencing, upper and lower impression, and PVC bite registration. Patient's photograph and a prescription form containing the patient's diagnosis data is submitted to the Align technology. Then in 3D computer modeling, the PVS impression is transformed into 3D images. And the click check software uses the practitioner's preferences to generate the computerized stages between the start and finish of the treatment. After that, dentist approves the click check, and this dentist has to look at the click check and approves the treatment. And if any modification is to be made, it is notified to the Align technology. Aligners manufactured and shipped. Align technology uses a sequence of graphical images combined with CAD/CAM to produce the clear, lightweight aligners and post them to the dentist. And at last, monitoring the treatment, the dentist delivers the appliances to the patient and monitors the treatment so as to achieve the planned treatment. Now, Invisaligners are more preferred than the braces because they